I'm so excited. I told you all, I just want to stop and kind of just talk to everybody. I really appreciate so much that you decided to hang out with us tonight. And I think that the fact that you are here says a couple of things. First of all, thank you for your support. But then also, at least you might be curious about the start of how African Americans actually really were able to become great clinicians. We're living in a vastly different time where right now everything is confusing, everything is uncertain, and certainly it feels very new to us in some ways. Like we're on high alert. And then as I think about this movie and this documentary, I think about that the pioneers of medicine were actually probably in some of the same situations that we face right now. And so anybody that has taken a look at the documentary, The Color of Medicine, should be ready and prepared to have a rich conversation tonight. I want to access the use of the chat as I tell you my disclaimer. If you have done your pre-assignment, and that is that you were supposed to watch the movie, if you have done that in its entirety, please go ahead and put a thumbs up in the chat. Or not the chat, but in the little beautiful little thingies that you all were doing. Let's see if you all are listening. Okay, I got some people. All right. I think some people have learned. All right. I like. I'm seeing all of those. Go ahead. Let me get to my perfect. Nice. All right. So with that being said, one of the things that I'd like to do is to give you a disclaimer. This panel discussion is presented as a space for education, reflection, and meaningful dialogue. The views and experiences are shared by our panelists and their own, and do not necessarily reflect the positions of any affiliated institutions or organizations. We are a non-biased group committed to fostering an open, inclusive, and respectful environment. We do not discriminate based on race, gender, religion, or any other identity, and we welcome diverse perspectives in the spirit of learning and progress. Additionally, I am the host. I'm not receiving any payment or compensation for organizing or moderating this event. We believe in the power of storytelling and shared experiences to foster understanding and growth. This is a space where all voices will be heard with respect and compassion. We encourage the audience engagement. Feel free to participate in the chat, share your thoughts, and use the emojis to react and celebrate the conversation. Disagreements may arise, but they should be handled with civility and a focus on constructive dialogue. At the end of our discussion, we will have a dedicated time for Q&A. Please drop your questions in the chat. Our moderators will do their best to answer those or keep those together for me so that we can reconvene and come back. If you go to the agenda that is listed in the event website, it is posted in the chat, you will see our agenda for tonight. All right, I think I said everything. Did I leave anything out? My panel members, did I leave anything out? Was everything? All right, here we go. All righty. So again, on page 2 of the event website, you will see our agenda, and we're going to do our best to stick to it. So with that being said, I'm going to go ahead and introduce our panelist. We are incredibly fortunate to have with us today a true leader in the field of occupational therapy. Please join me in welcoming Cheryl Brooks. Cheryl brings a wealth of hands-on experience, having worked with diverse populations from children to seniors and in various settings, including home health. As a tenured faculty instructor and academic fieldwork coordinator at South Suburban College, she not only is shaping the future of OTAs, but also ensuring they receive invaluable practical experience. Her dedication extends beyond the classroom. She's a certified professional licensed in 2 states and actively involved in national and state occupational therapy associations, including the National Black Occupational Therapy Caucus. She is passionate about promoting the profession and inspiring others to step outside of their comfort zone. Above all, she is a mother of two and a strong advocate for embracing new challenges. Let's give a warm welcome to Ms. Cheryl Brooks. Go ahead and wave for me. Thank you, thank you, thank you, thank you, thank you, thank you. Nice. Welcome, welcome, welcome. All right, next up on the panel, we are honored to welcome Dr. Dawn Brown. Dr. Brown is a leading figure in physical therapy education, serving as the Assistant Chair of Curricular Affairs and Assistant Professor at Northwestern University. Her expertise extends far beyond the classroom. Dr. Brown is a driving force in educational research, with a prolific record of presentations and collaborations. She has held significant leadership positions, including her work in the American Council of Academic Physical Therapy's National Equity, Diversity, and Inclusion Commission and the Illinois Physical Therapy Association's DEI Committee. Her dedication to advancing the field is further demonstrated through her advisory roles and her appointment to the Illinois State Board of Health, where she contributes to policy and rural development. Dr. Brown's research, focusing on leadership, faculty development, motivation, and belonging, has made a substantial impact on physical therapy education and practice. Please join me in welcoming Dr. Dawn S. Brown. All right. Okay. We got a hand raised. All righty, here we go. I'm going to keep going with that hand raised. I think sometimes we hit that on accident, but if you didn't, Miss Gail, we're going to come back to you. We are delighted to welcome Dr. Lucas to our panel. Dr. Lucas is a board-certified pediatrician who serves her community in Harvey, Illinois. She graduated with a bachelor's in biology from Wash U and a master's in health care administration from the University of Illinois and a doctorate in medicine from Meharry Medical College. She completed her pediatric residency at Advocates Children's Hospital. Dr. Lucas is passionate and Dr. Lucas' passion for healthcare extends beyond clinical practice. While pursuing her master's degree, she served as a public health educator, promoting healthy lifestyles in Chicago schools. Her time at Meharry Medical College instilled a deep commitment to equitable health care, particularly for underserved populations. As a general pediatrician, she focuses on preventative care and empowering families to make informed health decisions. She is also the author of a children's book, Hey Baby, and understands the importance of instilling healthy habits early in life. Dr. Lucas, thank you and welcome. Everybody give her a shout out, all right? We got two more. I have some power pack people on my panel, don't I? That's why I don't get to talk, because I want them to talk. All right, here we go. We are honored to have Dr. Cherise Thompson join us today. Dr. Thompson is an accomplished dentist and educator, serving as an associate professor and community outreach coordinator in the dental hygiene program at Malcolm X College. Dr. Thompson brings a wealth of practical experience to her teaching, having practiced general dentistry in Chicago for 2 decades. She currently teaches nutrition, community health, and radiology, and serves as a supervising dentist in the college's clinic. In addition to her role at Malcolm X, she is also a restorative clinical instructor at the University of Illinois Chicago College of Dentistry. Her dedication to teaching has been recognized with prestigious awards, including the NISOD Excellence in Teaching Award and Educator of the Year from Phi Delta Kappa International. Dr. Thompson is a fellow of both the American College of Dentists and the International College of Dentists, and has served as the executive board of the Chicago Dental Society. Please help me welcome Dr. Thompson. All right, I've got both doctors in the middle of the screen there with their white coats on. All right, I love it. Lastly, we have Ms. Nicole VC. We are pleased to welcome her to the panel. Nicole brings 17 years of experience as a counselor and school psychologist, working with students from pre-K all the way through high school. She is currently working towards her doctoral degree in psychology and is a strong advocate for students learning with differences, and currently works to support, identify, and plan for these students. Her background as a counselor and school psychologist fuels her passion for mental health awareness. Nicole believes in holistic approach to education, understanding that physical and mental health are deeply connected. She lives by the powerful quote from Frederick Douglass: "It is easier to build strong children than to repair broken men." Wow. Well, that was a mouthful, but I am ready now that you have an understanding of who is before us. I think that we should begin this conversation. Let me catch my breath. ah. All righty. So if you look at the website, we are going to cover a couple of areas tonight. We're going to talk a little bit about health disparities and advocacy. We're going to talk a little bit about the imposter syndrome and a sense of belonging. We're also going to talk about diversity, equity, and inclusion plus, student success and institutional relationships, and then also clinical education and professional development. All righty. My panelists don't know who I'm selecting first, so I will just decide who's going first. All right, Dr. Lucas, I'm putting you on the spot so you can unmic yourself. Your first question in regard to the imposter syndrome and belonging is this: many Black healthcare pioneers face discrimination and doubts about their abilities. Have you ever experienced imposter syndrome in your career, and how have you worked through it?
So, yes, I have. Again, thank you for having this wonderful event. I just want to say that. So I was actually, this was before I was practicing. I was in a pre-med enrichment program, and a professor told me that basically I was only there because they had to fill so many minority spots due to affirmative action. And it really hurt me deeply. It made me feel like I didn't belong. There was one other minority there besides myself. I was the only Black female there. And it prompted me to doubt myself at the time. Ask myself, do I really belong here? Am I prepared to become a physician? Am I enough? Maybe I need to do something else. There are other careers in my family. Maybe I should ask them, how do you like that job? Can you teach me about it? But that lasted not too long because I tried not to let people deter me from my goals. It just kind of reinforced what I already knew, that unfortunately there are some people in the world who are ignorant and uninformed. So I try to just get back to work, not let people get in my head. So basically just be my best. Sometimes you have to work harder than other people do, your peers, to accomplish the same goal and just to be recognized. But if that's what you have to do, that's what you have to do. So I'm constantly trying to broaden my knowledge, maintain my confidence, and always being ready. I think it's a saying, they say, stay ready so you don't have to get ready. So that's my motto. At the same time, though, I think it's important to always give yourself grace. You don't have to be perfect. No one knows everything. Just do your best. Believe in yourself. I constantly have pep talks with myself and tell myself I am enough. Sometimes remind yourself you didn't get this by luck, because people will quick and say, oh, you got lucky, oh, you knew someone, and they try to discredit you. So no, it's not luck. I put in the hours, I earned this. And celebrate your accomplishments. My husband would tell you I probably celebrate too much, but I celebrate anything. And you are not an imposter.
Wow, 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 wow. Thank you so much. And the reason why I started there is because I really think that that is the essence of the reason why Homer G. Phillips Hospital was so successful. So, for those of you all who did get a chance to watch the documentary, and those of you who didn't, Homer G. Phillips Hospital was a hospital that was established in the late 1930s, and it existed in St. Louis until about the 1979, I believe. And the reason why that's important, I wanted to bring that up, is because, of course, Dr. Lucas did attend WashU, and I know we have some WashU representatives here tonight as well, and I appreciate that. But there's such a rich history behind the reason why the hospital was even created. The hospital was designed for African Americans because at that time there were two hospitals in St. Louis. There was a hospital number 1 and a hospital number 2. And of course, we were segregated at that time. Homer G. Phillips was an attorney, and he was really responsible for the establishment of the hospital. Unfortunately, he was murdered before the hospital was established, so he never got to see it be in existence. But the whole point of it was, at that time, there were doctors coming from Meharry and Howard and all over the country. They were becoming doctors, and then they had nowhere to practice. So now let's double back to what Dr. Lucas was talking about, the sense of belonging, the imposter syndrome. Can you imagine, to all of my students that are out there tonight, or students in general, can you imagine working as hard as you are for your nursing degree, for your PTA degree, for your PT degree, whatever it is, and then be denied the right to even practice? Like, we all understand that clinical education is important. You can do your didactic work all day long, but you have to get out and be in touch with patients. So now you're dealing with, I have nowhere to practice, and now do I really belong here? And so that's the reason why I wanted to stop there. I really want to encourage you all, if you have not gotten a chance to watch the documentary, that you do so. Thank you, Dr. Lucas. We're going to move on. I'm coming to you, Dr. Brown. The Color of Medicine highlights the resilience of Black healthcare professionals who had to navigate discrimination and unethical practices in their training careers. What advice would you give to students entering clinical rotations on how to advocate for themselves when they encounter unethical situations involving their clinical instructors or their site coordinators? And I'm going to listen to that.
Because that is a lot. So, Rhonda, thank you so much for inviting me to be a part of the panel. And I appreciate everyone who took the time tonight to be here. This is definitely a loaded question. And as a former director of clinical education and in education right now at a doctor of physical therapy program, this is very important for students in any healthcare profession to be able to navigate any kind of bias, unethical practice, discrimination, stereotypes, and the like. When I think about the documentary, we have to recall that those medical professionals, the nurses, the physicians, and so on at Homer G. Phillips Hospital, they showed up and fought because it was the right thing to do, to save the hospital, because that hospital meant so much to them for their past, for their present, and because of us for the future. And so it's important for students to recognize this as they review that documentary and think about where their place as Black students and as future Black professionals is in our healthcare system. And so we knew that the people in the documentary knew what the hospital did for them. It gave them agency. It gave them voice in their medical career. And so that meant they felt a sense of duty, if you will, and others to speak up and to speak out. And that's what students need to do when they are in clinical spaces where they are faced with discrimination, or they're faced with biases, or they're faced with microaggression. And so I have a couple of pointers for students that are in clinical rotations. Hopefully, for the majority of the part, you should be enjoying your clinical rotation. You're there to learn. However, we know that in reality, depending on what state you're in for your clinical experience, depending on the CI or the preceptor that's there to mentor, teach, and lead you, you may face some adversity. So the first thing is, when you are faced with adversity, know your value and know your worth. You can't and you should not let anyone take away your self-determination. You should not let anyone take away your right as a Black healthcare student to occupy space in a clinical facility. Then know your rights, know the policies, know the expectations of your academic program, know the expectations of your clinical instructor or the preceptor, know your own expectations for your learning in that clinical environment. And that way you can align those with the policies. And if something seems awry, then you're able to step up and say, hey, a line's been crossed. We need to do something about it. As I said earlier, speak up and speak out, despite the real, and I'll throw in perceived, power dynamic. We know that oftentimes students, especially students of color, when they're in academic spaces and their preceptor may or may not share one of their social cultural identities, they back off and they shy away, especially when there's a microaggression, there's a bias. But you can't do that. You have to step up. You have to be able to say, I teach a psychosocial class, and so we talk about I statements. And you have to be able to step up and say, hey, I felt uncomfortable when you asked this, or I felt uncomfortable when you did this, and be able to express ourselves and not fear retribution or retaliation, especially when it comes to the grade, if you will. seek guidance. And so you have your director of clinical education or whoever the person that's in charge of your clinical experiences is. Hopefully you feel comfortable and have a good relationship with that person to report incidents of bias or microaggressions. Hopefully there's someone else in your faculty, and there might be someone else that's outside of your institution that you can connect with and talk about experiences that you might have. Even those of us that are on this panel, that are attending as participants, make connections and allow those people to help support you and guide you through bias and microaggressions and the like. The other thing is to document everything, because you want to have that paper trail. So if you see frequent occurrences of unethical treatment, then document these things, because you want to be able to say, this is what happened on this date at this time. I did this to try to mitigate the situation. And here's what I suggest that we try to do going forward, because your number one priority in a clinical facility or a clinical experience is to learn, to be able to apply the knowledge and skill that you've learned in the didactic curriculum in the clinical facility. You shouldn't have to deal with racism and microaggressions there. And I would almost say above all else is to practice self-care, because we know as Black people and people of color that we will face microaggressions. We will face discrimination. Those of us that are healthcare practitioners right now and educators, we face that on a daily basis. And we know that you will face that as well, unfortunately, but you have to be able to take a step back and care for yourself. We know that your mental and emotional well-being is important, especially in today's society and today's climate. And so psychological safety and physical safety is of paramount importance. I would hope that your clinical director would not want you to stay in an environment where you don't feel like you belong and where you don't feel safe, because if that's the case, that's part of a larger problem and you should be removed from that situation. So my advice is, you belong in clinical spaces, and I hope that you feel empowered and encouraged and inspired to advocate for your right to be in these spaces. Thank you.
I think we should just have a mic drop now and just, I don't know, snap. I'm not sure what to do at this moment. It's so passionate to me, because one of the things that you said is so important to me is psychological safety. Like, as educators and as clinical instructors and site coordinators, we have to learn how to build community around our students. Like, I don't understand how we forget all of a sudden that we struggled, that we had to go through. Like, how is it that we get ours and then we look back and say, oh, you got to struggle. You've got to make, like, I don't understand that. Like, it is so important to me for my students to trust me. I am going to make mistakes as a director of clinical education. I am going to fall down, but it's okay to fall down if you're transparent about it and you get back up, right? Like, I think that people see your success and they see your failures, but they see that we're real people. How are we healthcare educators? How are we healthcare professionals if we're not empathetic to our students first and foremost? And I think that was the thing that came up to me. I've watched the documentary about 6 times now, and I get teared up every time, because I am just empowered by the fact I heard so many times people said, I know I could do it because somebody looked like me. I saw that doctor that looked just like me. I saw that physician being able to do that. I saw that nurse being able to do it, and they had high standards, and that's what I wanted. One of the first parts of the movie that was so interesting was that the people who grew up in the Ville, if you didn't know that, so this was a Black community in St. Louis, and I would love for some of my St. Louis people on here to kind of talk about that, because the fact that we had this whole Black community where everyone lived, doctors, lawyers, everyone lived, right? So we got the best of who we were because we couldn't go anywhere else. So sometimes when we even think about segregation now, it's frustrating to us, but I want to say that there was some power in that as well. Okay, so let's think about that. I know I said a mouthful and I'm not supposed to be talking. So Miss Cheryl Brooks, you are up next. Your question is this: the film illustrates how African-American medical professionals created opportunities for the next generation. How can clinical education programs today be more intentional about fostering opportunities for Black students, but all students of color? Let's keep that all students. Go ahead.
Well, you all have said so much already of thoughts that I've already had. The whole imposter situation, self advocacy. When I was looking up information to think about the subject, I just look back at the history of occupational therapy. So when we talk about um, the color of medicine, occupational therapy profession was so very similar. Um, our profession, our numbers say we're the Occupational Therapy Association, we're 89% white. And so when you look at 100%, that's only 11%. When I look at our National Black Caucus, that's like 5% that are of African American descent, of the Black therapists. Um, the hospital in St. Louis started like in 1939. I think that's what I remember seeing from the movie. Our first Black occupational therapist um, went to school in Mississippi, I believe it was, but she couldn't continue at that school because of segregation. So she had to be moved to another school in Louisiana, where it was really overcrowded. So the first Black OT really, well, she attempted her education in 1939, but the first Black OTs didn't come about until 1946. Occupational therapy began in 1917. So it took a long time for Black practitioners to come on to the scene. Um, so when you think about being an imposter, do I really belong here? All of those things kind of really roll into us being practitioners and doing the best that we can. Um, Looking for the next generation to really open their eyes, their hearts, their minds, to hear the words that some of the seasoned practitioners are saying, and doing your best. Don't sit back and take the back seat. Make sure you're at that table. You get into the room and you have the table, not the kiddie table. Sit at the big table. Work your way to that head chair if you need to show the skills, all the skills, the information that you have to share with your clients in any allied health field. Let me see what else I wanted to say. In 1974 is when the National Black Caucus of Occupational Therapists was formed. A great support it has been. I've been kind of intermittent here and there, but lately just really pushing forward because occupational therapy, our American Occupational Therapy Association, they're really pushing the DEI. We have so many different divisions and organizations because diversity, equality, and inclusion is important for all of allied health fields. You think about the disparities that are going on in healthcare, all those things that are kind of really happening. So we want to truly be a true forefront for that. Dr. Dawn said, she mentioned self advocacy. That needs to be so important for students going into clinical situations. Nobody's going to hand you anything. And that's what I tell my students. I say, you really have to, you know all this book work. Now, how are you going to apply it and apply your best foot forward as you're doing it? Because that's how you're going to make it. The micro aggressions that are out there, people will smile in your face, but then you always want to make sure you're documenting that you know your stuff. If you don't know your stuff, take a step back and go and study it to come back the next day and say, hey, you were explaining this yesterday. Is this really what you meant? And explain it to them so people can't say, well, you're just trying to breeze on through. Always put your best foot forward. So we clinicians, we really want to incorporate some DEI modules into our lesson plans to really help the students as they go out on their internships. Some extra training awareness for even our clinical educators or fieldwork educators, as we call them in OT. Try to provide whatever resources we can to help those who are helping to educate our students. We want to do that so that you all get the best experience. Um, See, everybody else said some things that I was already going to say. Talking about students that self-educate, and advocating for our organizations also. So, with our National Black Caucus, and they do have Occupational Therapy Association, we do have other divisions of caucuses for other nationalities. So try to hook up with those organizations so that you'll get what you need for support, for mentoring, because that's really important, to find a good mentor, somebody who will support you in your journey. Don't let yourself be out there alone, because you can reach out to your educators, reach out to some other students, find your student organizations. I do really recommend that your professional organizations, the PTA, the PT organization, AOTA, whatever network you have, I do recommend that people get involved with your organizations for advocacy. With all the different changes that are going on, we need to advocate for our professions. So don't sit back and let somebody say this is the way it is. Step forward, because that's what's going to help you along your journey. That's all for the moment.
Thank you, Ms. Brooks. I appreciate that so much. Thank you, thank you, thank you. All right, we've got one more question that we're going to take, and then we're going to let you take a break. I am an educator, and I realize that you might need to go potty, so I'm going to let you do that. But we're going to finish our conversation with with Nicole. She's almost Dr. Nicole Vesey. So here's your question. The documentary showcases African-American medical professionals fighting for equitable care. How can today's Black healthcare professionals continue this legacy of advocacy within their own institutions and communities?
All right. Thank you, and I apologize for not having my camera on. I'm just leaving one of my little ones is h- Black History Month program for them, so I apologize in advance for that and for the cooing in the background. Um, so my question is asking how we can continue the legacy of advocacy. Is that the question you were asking, Rhonda? I'm sorry. Okay. So we just look at how can we advocate for diversity? How can we help build those leadership roles, and kind of building off of the previous speaker, and just, thinking about our organizations and making sure they're reflective of who we are, and being active in those roles and not waiting for someone else to do it, but being willing to be a part of those change agents. Also looking at going back to what you said a few moments ago, Rhonda, talking about that mentorship and having those pipeline programming, and just really supporting and mentoring students of color to pursue these roles in medicine and in health, so that we're able to just continue to grow our fields in diversity, and just making sure that those opportunities are available in the workforce. The next point that I was kind of thinking of when I think about this question is, how can we continue to engage in our communities and build upon our education, and making sure that we're putting and providing resources for people of color to be able to engage with healthcare providers that look like us and are able to just build upon that. And then the next thing is just making sure we're involved in the medical research, and making sure that, when there's things going on, that we're being cognizant of that and being aware, and working towards really being able to push for representation in those spaces. And then I guess I have a couple others, and I'll just kind of briefly summarize them all together, just making sure that we're providing and for and encouraging cultural competency training, helping others understand the impact of implicit bias, structural racism, and just really speaking to the social determinants of just how our health comes together. Speaking about those things where medically, some of our needs are ignored or overlooked, or just not taken as seriously as they should be, and just making sure that we're kind of bringing that full circle when we advocate for policies and just making sure that our patients are even having the supports and services that they need in place.
All right. You see how we have to juggle multiple things here? So I appreciate that. Thank you so much, Nicole. All right, we're going to head into our break, but I want to leave you with this thought. First of all, take a deep breath and blow it out slowly. I really want us to consider in these next 5 minutes while you run around or do whatever you need to do, is it possible for us to change our perspective about what's going on right now in our country based on our conversation tonight? Maybe instead of being defeated because we feel like we are going back, we know that our former Vice President, VP Harris, ran under the ticket, we're not going back. But I think we are. But maybe instead of thinking about that as a negative thing, maybe there's nothing wrong with going back for a moment, as long as it catapults us forward. So when I think about going back tonight, I think about the fact that there were so many doctors that were connected to Homer G. Phillips Hospital that would not have made it had they not been there. And they were excellent clinicians. And they had a level of excellence that we can still desire after today. And so as you all take this 5 minutes, I want you to think about maybe we are going back, but maybe we're going forward too, because maybe we need to find our strength in our defeat. Maybe we need to find our strength in our anger. Maybe we need to find our strength in our resilience that will come out of the suffering that maybe some of us are truly experiencing right now. Okay, I could talk forever. It is 7:12. We are going to take a 5-minute break. So we are coming back exactly at 7:17 and 36 seconds. Okay. All right, let's take a break.
Hi, Chester. We're on break right now. They'll be back at in another couple minutes.
Okay, thank you.
You're welcome.
Okay, we are nearing 7:17, Rhonda.
All right, I am coming on. I have forgotten how to stop presenting. There we go. No, but I need to stop presenting. Hmm. Any of my students on the line know I have technical difficulties often. So thank you for bearing with me. I appreciate it. All right, let's get started again. Do not laugh at me, Courtney. That's one of my students messing with me. All right, all right, all right. So with that being said, let's take a good segue. I want to acknowledge some people that are here today. So if you are one of my students, but if you are a student from Prairie State College, could you go ahead and put a thumbs up in or do the thingy? Yep, I see you, Courtney. All right. Awesome, 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 awesome. Wonderful students here tonight. Thank you so very much. Are there any students? Now, if you're a student from anywhere, I met some wonderful students this year at Combined Sections meeting. So if you are a student from anywhere else other than Prairie State College, please put your thumbs up. I appreciate that so much. All right, all right, all right. Wonderful, wonderful, wonderful. All right. So I also want to acknowledge some people that are on the line. If you all didn't remember, Homer G. Phillips Hospital is in the great state of Missouri, right? And so there are some people here that have some connections there. And I want to make sure that we are aware of that. And he doesn't know that I'm calling on him, but I'm calling on him first. Dr. Julian McGee is here tonight, and he is Associate Professor of Physical Therapy and Orthopedic Surgery, and he's the Associate Director of Diversity, Equity, and Inclusion at WashU. So we got to talk about this because he's St. Louis, we got to talk about it, all right? Also, we have Dr. Dania Thomas on the line, and Dr. Dania Thomas is a dean at Lincoln University, and she oversees the schools of business, education, and nursing. So I wanted to just bring light to light those people who are associated with St. Louis. Also have Dr. Desiree Anderson on the line, who is Jenica and Celeste's lady in charge, right? And so welcome her tonight, and anybody else who is here. All my friends, family, appreciate you so very much. Thank you for hanging out with us tonight. All right, let's get back into our discussion. Are we having a good time? Is this good stuff? Is this well worth it? All your time that you're sitting here, is it well worth it? Well worth it? All righty. Good deal, good deal, good deal. All right, here we go. Let's get back into it. Dr. Sharice Thompson, I'm coming to you. Historically, Black hospitals and training programs provided a critical support for Black healthcare students. What lessons can modern medical institutions learn from them to better support African American students today?
Well, thank you for inviting me, and I want to thank. I saw a few of my students on thumbs going up, so thank you so much, Rhonda, for having me on here. And I just want to verify again the question you gave me, because I know there are several. So you want me to just repeat discuss the.
You ready? You want me to repeat it for you?
Yes, repeat one. Yeah, because I was ready for the first one.
Okay. Would you like me to go to the first one?
Yes, please.
All right.
I'm ready for that one. It was going to be a great segue into what you left with.
No problem. No problem. All right. The color of medicine highlights the historical health disparities and segregation in medical care. How have these historical injustices shaped the healthcare system we see today, and what steps can we take to address them?
Excellent question. And here's just a few things that I wrote about after watching the documentary, and listening to all of the other panelists. You left us with a question to say, is going back, it could be good or could it be bad? And I say going back is important, because when you go back, you have to know your history in order to know where you are right now. And I say going back is, and I quote from the documentary, going back is a way for us to find to see the excellence of the few that affected the many. So I want to just say that again. Watching the documentary 3 times, the going back was an emotional moment for me and also an educational moment for me as a clinician and as an educator, because you pinned it when you saying, when we go back, what does it do? And I wrote at the top of my notes from watching the documentary that said the excellence of few affected many. So when you ask me the question about health disparities and segregation in medical care and those historical injustices, I had to break your question down and look at historical injustices and think about the historical injustices that was going on at the time, with the documentary pointing out the inadequate conditions, the poor care of those patients, and all the things that was going on through the Jim Crow era pushed this moment of where excellence and what we needed to do as clinicians and doctors to get the care that our patients deserved. And that brings a word about that I'm just going to say to some of to some of our students who may have heard it, and to some of our panelists. And we kind of said it a little bit earlier today, um, uh, about the word health disparity and social determinant. So I have my screen up in front of me because I teach this in community health, and I just want people to know that this term health disparity was brought about in the 1990s. I graduated dental school in 1995, and I don't recall learning about health disparity. It probably might have been mentioned, but I don't remember. But when I start teaching, that's when I first learned that term, over 5 years ago, when it was coined and recognized by Healthy People in 2020. And I just want to read this to the viewers. I'm reading it directly from the literature, which is from public health, from What Are Health Disparities and Health Equity, which comes from public health. And in here it says, and I want our people to know today, it is a particular type of health difference that's closely linked with economic, social, and environmental disadvantage. When we talk about health disparities, it adversely affects group of people who have been systematically experience greater social or economic obstacles to health based on their race, ethnic group, religion, social economic status, gender, age, mental health, cognitive, physical disability, sexual orientation, gender identity, geographic location, etc. When you look at this documentary, the health disparity that was going on with our people, when you look at the documentary, it talks about how the veal was the answer to those disparities going on in the day, where we economically were in a situation where we had to support ourselves with the businesses around us. We went to our own doctors, we had our own attorneys, we had our own teachers. That was a disparity going around. But then this gentleman, this wonderful lawyer, decided there is a disparity going around, so we need to do something. And that's where the hospital was built from. So I say all that to say that the historical injustice that this documentary discusses is what we see now coined as health disparity. And then to add on to that, we talk about the word socially, socially disadvantaged. And then we talk about determinants. And when we talk about those things uh, in our society, the 5 domains of social determinants of health, the hospital was built because we recognize that if we could support our doctors who could only be seen by people who look like us, they were putting back into economic stability. They were there for education. We were dealing with healthcare with our own people. Our neighborhoods were being empowered, and then our social and community was also being empowered. So the question also asks, do you see how we address them today? The same thing, going back to our history and looking at what this hospital did to help our people, and what we must do today as clinicians and doctors and educators to continue to work with that health disparity that we're seeing right now.
Thank you so much. Thank you so much. You brought up so many good points that the movie highlighted that I loved. I love the fact that, well, I shouldn't say I loved it. but I loved the pride that was put forced really upon us because that's all we had to do, right? And so now sometimes, I guess where I'm going with that, sometimes now when we think about our HBCUs or we think about something being all Black, our implicit biases say, oh, that's got to be, maybe that's bad, or maybe that's not going to be as good as our white counterparts. And I want you all to see and know that this hospital was pristine. It was
Prestigious.
huge. It was wonderful. It was a good place to be. Patients were coming from all over the country to St. Louis to get treatment because they couldn't other places. These doctors were so well known, at least early on, and they were going to other parts of the country to treat patients and to provide surgery for them. So let's think about the rich heritage, right? And I want us to really change the trajectory of our thinking, because I hate that. I hate the fact that when we hear something is all Black, or we hear an HBCU, or we hear a Black hospital, unfortunately, our mind doesn't always go to the pristine and the elite. And I think that this country, this world, whatever we've been in, has done a great job at making us believe that. And we've got to undo that. We've got to undo that. And it starts with acknowledging our health disparities, for sure.
Rhonda, can I just add one more thing on top of that layer? Is I wrote down so many different quotes that they said inside this documentary. Is it thrived because it couldn't. When you tell someone you can't do something, and let's go back to what we talked about a little earlier, this imposter syndrome. When you tell somebody you can't do nothing, you think you can't, they prove to us we don't have to have imposter syndrome. You're thriving because when other people tell you you can't do something, you find a way to do it. When you're that only person in the class that that is African American or whatever your nationality is, and no one else looks like you are setting yourself into a position to say, I have to thrive because I have no choice. Or they asserted themselves because they were dedicated to our race. Those physicians were dedicated to the people that they wanted to serve. And lastly, I want to say, in the dental field, that same pride came about for dentists. In 1913, the National Dental Association was founded because when we became dentists as African American dentists, we were not allowed into the American Dental Association. So we had to find and found our own association so that we could say, hey, we belong and we're going to work against this bigotry and discrimination. And today, the National Dental Association has what's called JETI, which is justice, equity, diversity, and inclusion, which is what this documentary talks about. So I'm just going to end on that point. Goes back to help us recognize where we need to go moving forward. And that's what our ancestors did for us when they founded these organizations and this hospital. It was pride for sure and excellence at its best. And that's what we should be striving for when we are in these clinical situations as educators, as clinicians, as students. Strive for the excellence that our forefathers, that the doctors that set that path for us did for us. Don't accept anything but excellence. And last thing, we as instructors, we demand excellence. You may say, why is this instructor hard on me? Or why, and I'm going to be transparent here. I would think that sometimes the Black instructor was hard on me. And I'm like, why are you so hard on me? But now I understand it because you were demanding excellence from me. And I see that implicit bias in me sometimes with my own students. And I'm saying, I am demanding excellence from you because I know we have to work so much harder and fight so much harder so that we show that excellence when people think we can't.
I think I'm going to have to clip recordings of this session and just play it like blasting in the Peace Center, especially around midterms and finals, because this is I wish all of our students, especially all of our allied health students, could hear this. We, Celeste and I, get the advising part of this, the advising side of it, where students are talking about registering for classes, and they come and they're talking about professors here in between. We hear the good, bad, the ugly, and I have felt this before from professors that I could see, well, tell me about the situation. And that's what it sounds like. I really appreciate all the work that you do with our students. And I wanted to jump in because we do have a student that has a question. I don't know if you want to have Elijah wait till the Q&A at the end, or if you want to have him ask his question now, Rhonda. I saw that he had a hand up.
I know. Elijah, do you mind waiting until we get done? Are you going to stay around until we get done?
Yeah, I'll stay around. That's no problem.
Thank you so much. Thank you so much. All right, Dr. Lucas, it's your turn. The Color of Medicine highlights the barriers Black healthcare students and professionals have faced in historically inequitable systems. What advice do you have for students on advocating for themselves when they encounter unfair or inequitable situations in their educational programs? I need all of my students to listen. Let's go.
So I'm going to say there is some overlap with what Dr. Brown had mentioned. But first, I would say keep lines of communication open, like meet directly with the source. If it's your professor, ask to meet with them after class. Express your concerns, as well as it's important to make sure that you listen to their opinion too. A lot of times it can be a misunderstanding. You have to make a distinction between like actually being attacked and constructive criticism. I feel like a lot of times people feel like, oh, they're attacking me or they're harsh on me, they're mean, they don't like me. And it's actually constructive criticism. Uh, um, which is a good thing because it improves your overall preparedness, especially with healthcare. You're going to make mistakes in your training, but that's why you have your superior to correct you before it gets to the patient, because one day you're going to be on your own. And if you make a mistake, it will actually affect the patient. And we're dealing with lives here. You don't want that. That being said, if you do actually find yourself in an unfair or inequitable situation, always believe in yourself. Don't let the situation get you so bothered. I say it all the time. People's grades start falling. They're doing bad in their clinicals. Don't let that person get the best of you, because if they really do have malintent, that's exactly what they want. So don't do that. And then talk with the superior. Like I said, if that doesn't work, talk to their higher up. Keep escalating it until you get the outcome that you want. And then also we touched on this a little bit. Know your school policy, know your rights. Don't talk to them and tell them, oh, well, I think I deserve this, or I would like, no, we don't have time for that. State the facts, reference your student handbook, tell them per our handbook, page 43, paragraph 2. If this, then that, or under this situation, I'm entitled to 6 months, or whatever the case may be. Because they need to know. They can't just tell you anything, and you know your rights and what you're entitled to. Also establish a network of trusted healthcare professionals that you can seek support from, and they can give you feedback. They may have different resources that can help you, or just ideas to help your situation. And lastly, I'd say there's strength in numbers. So talk to other people. A lot of times you're not alone. You think so you're going through something and you talk to other people and realize they feel the same way, or it may be an instance that happened not in class in front of people, but this person may actually be doing the same thing with multiple people. So collaborate with other people and you all can advocate for your rights together.
Whoo, Dr. Lucas, let's end. Let's end. I'm sitting over here just rocking on my seat. Oh my goodness. Did you all hear what she said? That is about empowerment. You have rights as a student. You have strength in numbers. Do what your handbook says you're supposed to do in the event you have issues. I will say this, I want to add this on. I do think it's important, though, as educators, that we build psychological safety. I feel like I can be hard on someone if I have a relationship. If they trust me, I feel like I can be hard on them because they understand that my hard is not being mean. My hard is not being ugly. My hard is not being pretentious or, of ill gain. My heart is because I want to see you thrive. But if you don't have that psychological safety as an instructor, I dare you to go out there and believe that a student is going to believe what you say. And so that's just for my instructors on tonight. Whatever you're doing, I just ask that you think about building psychological safety. Thank you so much. I love that. I'm going to take a little, can we TikTok a piece of stuff? Can we make TikTok videos about a piece? I don't know. We should. All right, let's keep on going. Dr. Brown, The Color of Medicine highlights the importance of the representation and equity in healthcare. With the rise of anti-DEI laws and policies in some states, how can healthcare professionals and educators continue to promote diversity and inclusion in meaningful ways?
So I had to say a prayer before I respond to this because I'm hot off the press from our conference in Houston, and this stuff gets me fired up. So the short version, going back to the documentary, and I appreciate this question, going back to the documentary, when you listen to the physicians and the nurses talk about why they came to the hospital, many of them knew someone. They had family, they had friends who worked there, and they wanted to become a physician and a nurse. And once they were there, they fought for the representation as Black people and for their place in medicine against, and fought against the closing of the hospital in 77. And so when I listened to a point in the documentary, there's a group of women, I presume many of them were nurses, they recanted their lived experiences and their perspectives being nurses and learning and growing at Homer G. Phillips Hospital. And that resonated with me, especially when we fast forward almost 50 years later and we're dealing with this new administration, we're dealing with these anti-DEI laws and this flurry of chaotic and confusing executive orders. And so because of that, we as healthcare professionals, and especially as Black healthcare professionals, have to be proactive and not reactive. And when I look at the news, and I try not to look at too much of it, but I'm curious, a lot of this are people are reacting, whether it be in clinical spaces or in educational spaces, without having knowledge about what these executive orders and anti-DEI laws mean to make sure that diversity, equity, and inclusion stays at the forefront of our priorities. And we have to recognize that when we see these things, there's all this information, and 9 times out of 10 is meant to cause chaos and confusion, so we can't see the forest through the trees. And so when I was in Houston at our combined sections meeting for our physical therapy profession, I talked about leadership and how leadership needs to cultivate the 4 A's with regards to how we combat anti-DEI laws and regulations. And those 4 A's were grounded in awareness, attitude, action, and accountability. So briefly, when I talked about awareness, before we can dive into preserving and prioritizing diversity, equity, and inclusion, we have to make sure that we understand the laws. We know what they are. We read beyond the headlines and dig deeper, look at reputable sources so that we don't get caught up and then throw our hands up and say, it's too much. I can't do it. Close our DEI offices, start firing people, and let's just comply. We can't afford to do that, especially if we want to be represented in our respective professions. And so we also have to think about awareness of ourselves, like are we aware of these laws? What's our level of emotional intelligence? How are we able to use that emotional intelligence to manage both our own emotions and the emotions of those people around us, the emotions of the students that we teach, the emotions of the faculty and staff that we interact with? And so that goes into the attitude part. How do we feel about this? And how do others feel about this? Because overall, we have to be willing and able to model an attitude that says there's hope, that there's resilience. And we have to model an attitude that is going to fight against discrimination and harassment and retaliation, because these have no place in our educational and clinical environments. And then from awareness about the laws and then looking at our attitude, then we can proceed with action. Oftentimes we jump right into action, and that's not going to be sustainable. So once we understand and we check our attitudes, now we have to think about action, or in some cases, and in my opinion, maybe inaction. Because when we think about diversity, equity, and inclusion, and belonging and social justice and anti-racism, if those are grounded in your culture of your academic institution and in your clinical practice, then you're not threatened by these laws and these so-called executive orders. And so it should be business as usual. Yeah, if you got to change a name, fine. And we know that names like health equity does not mean diversity, equity, and inclusion. But if the work is grounded in your culture and the climate, meaning how people feel where they work with you, then they're going to do the work, regardless of the name change. So don't react blindly. Know these state and federal laws so you can fight anti-DEI laws. Know how your institution or your clinical facility measures and defines DEI, and adapt as needed. And then someone mentioned earlier about advocacy. Engage in advocacy. whether it's writing letters, whether it be going to your state capitol, doing something to be a participant in the fight beyond your walls of your organization or your clinical facility. And then once you're in action, then how do we sustain this? Because as I wrote in the chat earlier, we've been here before. I mean, think 1960s, think civil rights movement, think affirmative action, think about what's happened with the documentary we saw, think about 1990s, think about 2020. And so we've overcome this. We're going to overcome this again, and we'll come out on top. And then who knows, decades from now, it might resurface. But if it's ingrained in our culture, then it's sustainable. And so we have to make sure that we have our DEI priorities, that we make sure that our culture and our climate reflect what we feel about diversity, equity, and inclusion. And so looking at the documentary, I've watched it several times. It empowers me, and it should empower us to draw on strengths of our past successes as we continue to fight for diversity, equity, and inclusion. I know that Dr. Thompson mentioned excellence. And in the documentary, there was something toward the end where they said, Homer G. Phillips Hospital is called a symbol of excellence. And we as Black healthcare professionals are symbols of excellence. So we can't forget that as we combat this flurry of executive orders, all these anti-DEI laws, because our diversity as Black healthcare professionals and the rest of diversity, equity, and inclusion matters. All right, I'm gonna calm down now because this gets me fired up. Thank you.
I want you to go. Oh my gosh, thank you so much. I just want you all to know that the things that the clinicians have said tonight are so valuable to me because there is strength in community. So these ladies, there are many people on this call that I draw strength from. Like I draw strength from knowing that there are like-minded people that have the same agenda. And I think that we have to stay focused on that. You see so many people that seem like they're adversaries, right? That seem like they're against you. But I'm going to bring up an old, probably church term that push. Push means pray until something happens, but I'm going to say it's press. Press until something happens. People want us to give up. People want us to stand down. People want us to turn around. And we could get caught up in all the hoopla and forget to press until something happens. Right? We empower our patients all the time in physical therapy. Press one more rep, one more set, one more activity, one more functional. Press. I think if we remain like-minded people, we can press and push until something happens. All right. Okay. I'm getting too heated too. I shouldn't have done that. I'm sorry. I'm ready to do something else. All right, here we go. Ms. Brooks, I think we got mixed up. Is your question on diversity, equity, and inclusion as well? I think so. Is it number 5?
No, on our original sheet, I only had one.
Okay.
On the sheet that you sent.
I have number 5.
Yes.
I have 5 and 7.
I'm not sure how that happened. Okay. I'm going to read this. And then Ms. Brooks, would you like to? You said you have 5 and 7. Okay, Sharice, I'm going to come to you, Dr. Thompson, first for 7. Is that okay? All right. Historically, Black hospitals and training programs provided critical support for Black healthcare students. What lessons can modern medical institutions learn from them to better support African-American students today? Is that the one you're talking about?
Yes.
Oh.
Another excellent question. And after watching this documentary, and because it was beyond excellent, I'll start with watch the documentary. If we want our modern institutions, starting with the institution I'm in right now to all the ones we represent, this will be the perfect, what I call faculty development documentary to sit and have a place and space to talk, as Dr. Brown said, when you are demanding that we stand up for policies and procedures and be the 4 A's. Watching this film, number 1, and then having a discussion like we're having right now, that what this looks like for our students. Number 2, going back to the 4 A's that she talked about as a healthcare professional, being aware of what's going on, look at our attitudes, and how can we best support our students when we know there's something lacking. And then last is again going back to just starting with awareness, and awareness begins with what we're doing tonight. What you are doing is bringing awareness not only among the people that's in our community, but to our students, and enlightening them so that they can take this conversation on to other people. And I am willing to bet you that this will allow the support, and it would drive more conversations about what we need and how we need to do it.
Excellent, excellent, excellent. All right. Ms. Nicole, we're going to finish up with your question, and then Ms. Brooks, if you have something to say after that, then we'll let you, and then we're going to go into our Q&A section. I haven't forgotten you, Elijah. I'm ready for your question in a second. All right. So The Color of Medicine depicts the importance of Black medical institutions in fostering a sense of belonging. This is for you, Nicole. How can today's healthcare and educational institutions create that same sense of inclusion for Black students and professionals?
Yeah, so when we think about the Homer G. Phillips Hospital and just how it was a cornerstone for Black medical professionals, providing them with education, training, and just really advancing them in that segregation era, how can we kind of play that out today? We think about just making sure that again, I've kind of talked about it before, that representation and leadership, and just making sure that we mentor and advocate for those that are coming behind us. I think Michelle Obama once said, she reaches back for those behind to lift them up, because the climb is not just about me getting where I'm going, but also giving back to make sure that others come behind me, and keeping that door open, keep my foot in the door so the next one can come on in. So just making sure that we're giving that representation and leadership. Also making sure that the hospital served as a training ground for those Black medical professionals at that time. So we have to make sure that in a field where we're often excluded or where we might not feel welcomed, that we're making sure that we're able to provide education and training. So being those educators for students of color, students of diverse backgrounds, so that they have someone that they can aspire to be. I think someone else touched on that as well. So making sure those educational opportunities and that training is available to them, where they have those safe spaces where they can come in and open up and be able to ask those questions and be comfortable. Just also making sure that we have a community and support, that we're able to just provide that wraparound care, and making sure that they have an environment where they can thrive professionally and socially. That physiological need for just safety, and just knowing that psychologically, okay, this is a safe place and I'm here, I'm welcomed, I'm wanted, I'm deserving of this opportunity. That imposter syndrome will definitely get you every time, but we just have to make sure we have those spaces where our learners are able to feel safe and secure in their community. And then opening up opportunities for access, making it people aware that this is available to you. This is something that you're welcome to become. Making sure the financial resources are available to individuals who want to pursue these fields. Just making sure that there are diversity initiatives so that they're able to receive the resources and the support that they need. Just really breaking down those systemic barriers that can close off and create a blockade for individuals to continue to proceed forward. So just making sure that we just really look at how the color of medicine just kind of provide a historical context. So like you said, looking back at how we can kind of continue to move forward, and just making sure that the educational supports are there, the professional support is there, and that we continue to meet the needs of our learners and individuals who want to pursue these fields, and just really giving them that access and those opportunities. That's so key, especially in a field where the representation may not be there.
You see why I like these ladies? All right, all right.
Miss Rhonda, I am going to throw in Nicole. You're so right. I'm going to say something real quick. When I'm just thinking about being a clinical coordinator, a fieldwork coordinator, we want the students to understand that we want the best for them when they are going out. And the clinical setting when they're leaving the classroom, because there are still so many barriers out there. I mentioned before, people, they smile in your face like it's going to be all okay. But when you find yourself struggling in your clinical rotation, please come and talk to us, the ones who placed you there. We can work to fix the situation for you. You know, if it's shifting you to a different location, um, you're just really trying to find out where the educator, the fieldwork educator, is telling you you're lacking. We can help to work and fix that for you. Telling your classmates, the rest of the cohort, that you're having problems, that's all okay, good too. But please come and talk to us so we can work on those barriers that are out there, because some people, yes, they want you to succeed, and some people can care less. They're getting their certificate, they're getting whatever it is they need to get, and they're fine if you're out there falling on your face. So please don't wait till the very end to talk to us, because we're there for you as students, because we struggle through some things to get to where we're at now. And we don't want the struggle to be as hard for you. There will be some bumps in the road, and that's the way life is. My students tell me now, well, Miss Brooks, life be lifing. Yes, life be lifing. But we want to help you through those little struggles along the way. So please be open enough to us to come to you, because we try to be as transparent with you as possible about what the real world looks like. That's it. Thank you. And I'm happy that I accepted to come to this group. Thank you.
I am happy that you did as well. I am happy that you did as well. So she put a charge on us. Anybody that is a director of clinical education, coordinator fieldwork, she put a charge on us. We have a responsibility. We cannot just throw, I know I call them my babies, but I cannot just throw my babies out there to the wild and expect that they're going to thrive. Right? That's our responsibility. I charge each of you that are directly involved in clinical education in some kind of way to take that into consideration. All right. All right. Let's move into a Q&A. I'm really excited, Jenica. I'm not doing too badly in terms of time, but I am going to open up the floor for questions at this moment. And I want to make sure that we go to Elijah first, and then we will do our best to try to answer. We'll probably be around another 10 minutes or so, just so that we're respectful as much as we can be of your time. So Elijah, you have the floor.
Hi, thank you. I'm gonna just introduce myself briefly. My name's Elijah. I'm a pre-dental student at Prairie State College right now. I just had a question. I noticed like we have a lot of black doctors, black health professionals in the call. So my question to you guys is, how do you guys, as black doctors, use your personal experience as black people to show up for your black patients or patients of color?
Please, can I take that one? Can I take that one?
Thank you, Elijah, for your
Yes,
question.
please.
Well, first, Elijah, I am excited and ecstatic that you are thinking about my field, dentistry, because you said you're interested in the dental field. So please get my information from Professor White, because I definitely want to do the first thing is engage you with other students who are in the profession. And I feel like students who are already going through it are the best resource or mentors for you. But your question was about how do we advocate for as a African American or Black provider for our patients? Is that the question?
Yes.
um, you do it with compassion, and you do it with an understanding of your culture, and listening and making sure that you're hearing what they're saying. And I say that because today was a perfect situation where I was advocating for a patient of color, trying to deal with barriers, trying to get dental care at another place. And so I find myself going the extra mile for all of my patients, but especially when I see someone in my community really struggling and need to get a barrier broken down, I feel like a superhero. And I really work hard to make sure that they can get that treatment or that resource, if it means calling people I know to help them to get that. And now I will go. I say I do it definitely for all patients that come in, and but if I know particularly of a story or of a situation for someone of color, I definitely purposely want to go that extra mile, because I know the barriers that are out there, and sometimes when they don't know, they can't do any better. But when I know I can help them, I dig in and go as deep as I can to help them as a provider.
Absolutely.
I hope that
Yeah,
helped.
no, that's great. That was perfect, and I definitely will get your information before I leave out of here for sure. Thank you.
He is one of my scholars. I know he will find that information.
All right. Well, one way you can do that before, I don't want anybody to leave yet because we're not done, but I want you to know that in the chat, you have the website as well as you have a direct link to our survey. At the bottom of that survey, Elijah and everybody else, is my email address. So what I'm going to ask you to do is fill out that survey. When we get done, don't do it yet because we might have one more piece that you need to tell me about. But if you email me, then I can definitely connect you with Dr. Thompson. Are there any other questions? Anybody tonight? If you don't feel comfortable unmiking yourself, we can take a look in the chat. But is there anybody else who might have something that they want to share? Question, comment, or concern? All right, go ahead, Courtney.
Hi, I wanted to go back to the beginning when we were talking about imposter syndrome. And if anybody had any tips, things that they do, routines that they do, especially being a first generation college student, any tips are highly appreciated.
That's my student. You all answer correctly. Answer loudly for her.
I would just say, as someone working in psychology, connect with those that are around you to really open up the lines of communication and to really build a network, so that when you start to feel overwhelmed, when you start to feel that you're in a position where you don't belong, then you have people there to affirm you and to continue to push you to get to the next level. Another great tool is journaling, just kind of writing and expressing, and going back and looking at what you said a week ago after you've kind of sat and chewed on it. Sometimes it helps you to reflect and like, wow, I did overcome that during this time. Or I was able to, be successful in this or that. So making sure that, you can kind of use those kind of resources, having someone to talk to, confide in, even professionally, someone that you can speak to kind of give you some feedback, because sometimes what we see and what we're living in that moment, we don't take in the successes that we've had and really give ourselves that credit that we truly and we truly deserve. So those would be my tips that I would give there.
Those are perfect. Those are perfect.
I'd like to add to that.
Sure.
So when looking into imposter syndrome, there are actually 5 different types. They are the genius, the expert, the soloist, the perfectionist, and the superhuman. So I would encourage anyone who feels like they may have encountered that at some point to look up the different types. I won't tell you more about it right now, but figure out which one you are. It's nothing wrong with imposter syndrome. I think we have all experienced it at least once at some point in time. I probably felt that way last week. Like, they're asking me for my advice. I mean, yeah, they're asking me for my advice. That's right, So find out which type you are, and then that way you can really attack it and figure out how to be different. I looked into it. I'm definitely a perfectionist. With everything in my life, I have to have everything be perfect and stuff. So knowing that, then I know to tell myself sometimes, hey, it's okay. It doesn't have to be perfect. It's okay to make a mistake. So figure out which one you are, and that can help you better figure out how to help yourself.
Wow. Go ahead. I'm just going to tell you all, I'm popping a link in there. I didn't vet it yet, but I just looked up the 5 imposter syndromes. I'll put it in there, but you'll have to do some fact checking on it, but it did have the 5 types. Go ahead, Dr. Thompson.
So I do what my students do, and I ask them Google real quick, and I put it in there because I first heard about it reading Michelle Obama's book, and I had to look at that. I'm like, what's this? And then of course after that, it was like every faculty development from there, the word just start popping up and going out. about, and I've even talked to it among our dental hygiene students and dental students. But I'm looking at the word self-doubt of intellect, skills, accomplishment, high achieving. If you're going into a healthcare career, you are a leader and you are a high achiever, so you think that you don't belong, but you're already a leader and a high achiever. So you're telling yourself or doubting yourself that I can't get the skill. I don't have the intellect. You're doubting yourself. And I agree with you, Dr. Lucas. Like a week ago, I'll be saying the same thing. So I'm like, oh, you should be doing this, or can you do that? And I'm like, I'm doubting myself. I don't think I'm there yet. But I think we all go through it, and it's great to know that there are 5 different steps. But I just want to advise those on this call, when you feel like you may be going through that again. I agree with the journaling. I do that, and I write it down, and I ask myself, why am I not feeling worthy? Why don't I feel I can accomplish this? So again, I go back to that attitude. And again, one of our panelists said, know your value, know your worth. And when you know your value and your worth and the expectations, and I think that will help you recognize that you're trying to self-sabotage yourself, and you just have to throw it out of your mind and push, as we say, what do you want to press? Keep pressing forward, and speak to other people and let them know what you're dealing with, because you'll recognize that you probably are feeling the same way someone else does, and there's strength in those numbers. So definitely journal, seek out the resources, and tell yourself every day when you get up and look at yourself in that mirror, I am worthy. I am worthy of this. I am valuable, and I have rights and responsibilities that make me who I am today.
Awesome, 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 awesome. We're going to church here today. I love it. I love it. I love it.
We
All
had
right.
a couple of hands up. One before Jory that I can't catch right now.
You're saying not don't go to Jory, or do?
No. Somebody else raised their hand before Jory. Who was it?
Oh. Okay, we'll let Jory talk, and then that other person needs to raise their hand again, and then we'll
Okay.
let that be the last question. Although I want to stay here all night. I really do.
When is the part 2? Like,
When is part 2? Come on, Jory. You have the floor.
Hi, my name is Jory Wilson. I wanted to introduce myself first. I'm an undergraduate student at the University of Kentucky in my junior year, and I major in biology and minor in pharmacology on a pre-med track. And I'm just starting to get into a lot of like clinical work and wanting to shadow as well. But I've noticed before even getting my foot in that door, there is a big mistrust in healthcare for physicians, for people of color and minorities. And I just wanted to ask maybe some steps that maybe I as a patient can do, or in stepping into that world to try to help combat that and have a different level of transparency for patients that might not be so willingly to trust physicians.
You
I
got us stunned here. Go ahead, Dr. Luke.
I would say, as a patient, don't be afraid to ask questions. I like it when I'm a pediatrician, so I like when my parents ask me questions. Sometimes the kids do too, and I'm like, I'm listening. Okay, 6-year-old. But for the most part, the parents, I like it when like they feel like they're being not disrespectful, but I don't take it as disrespect. Like, this is your child, this is your body. If you're the patient seeking an adult doctor or whatever, like, you have a right to ask questions. I'm not offended at all. So I think as a patient, if you ever ask a doctor a question and they kind of give you an attitude or feel like, you can't question me, you need to find another doctor. I embrace all the questions. And then as a doctor, I feel like, one, I like to explain things in simple terms. Not They didn't go to medical school. I went to medical school. So I hate it when you're talking and you say all these big words and you're like, any questions? And you said so much, they just like, no, but they didn't understand a word you said. So I always tell myself, keep it simple, and always meet people where they're at. So if we're talking nutrition and you have McDonald's every day, I'm not going to tell you not to have McDonald's at all. Stop cold turkey. I'm going to ask you, well, maybe we can try maybe 2 times a week, like meet people where they're at and be realistic with your goals.
I like to add to that and go back to Elijah's question about being being a Black doctor in a space with your patients who look like you. Cultural sensitivity, and that's another term. When we have that cultural sensitivity about the people that we're serving, no matter their background, their race, their religion, or their culture. The more we can have cultural sensitivity and understand and know what that is, I think that makes us better healthcare providers, because you can go into that space, and be transparent with them as much as they can. And I do agree with Dr. Lucas. As even as a dentist speaking with patients in the clinic or when I had my practice, I wanted to be as transparent with them as possible. Bring the language to them as they could understand it, not be up here with high clinical terms, but to make sure they understood it. And then also, I didn't even know that was my training ground for education. I didn't know my chairside manner with my patients and my dental practice was preparing me to be an educator and teach the profession. And when people know you're genuine and true, they will respect those questions that you have and say, no, I like to say no question is a dumb question, because you just may not know. And you know better. When you know better, you can do better. So be comfortable asking questions, especially if you are wanting to seek to go into a healthcare profession. Use that as your platform to learn as much as you can. And I agree, if that doctor is not willing to give you an answer to your liking, or dismiss you, or look to you as why are you asking all these questions, that is your cue to say, this is probably not the right provider for me.
You have autonomy as a patient. You are a part of the team. As a student, you are a part of the team. Okay. Don't discount. Don't look at that power of authority or that abuse of power that some people use in those positions. You are a part of it. Okay. Dr. Edmonds, you have to have the last comment, and then we got to have a part 2. I guess that's what we got to do. All right. Can we come back next week? Same time, same bad location. Go ahead, Dr. Edmonds.
It's actually not a question. I think it just got missed in the messages, or maybe I missed your response. Jacinta L said, "Are Africans also included? Sometimes we just feel left out being in a foreign land." And I'm not sure that was responded to yet, because it's a pretty powerful statement. Jacinta, I don't know if you wanted to say something more about that.
That's my student. Come on, Jacinta, come online.
Yes, that
If you
was
can,
really
Jacinta,
powerful, if
yes.
you can.
Jacinta said y'all dismissed me.
Hello. I'm
Hey,
sorry.
Jacinta, thank you for being
Yes,
on.
I'm sorry I'm on the road, but I don't know if you can hear me.
We can.
Okay, so sometimes we get mixed up, and it is hard to understand the culture in a foreign land. And you feel fear of sharing even the distress or things that happen in the office that you don't want to share them. And it becomes so hard. So sometimes we feel like we are left out in this society unless you find someone to talk to.
So to me, what I hear you saying is you are having some difficulty at times because of your ethnicity or race, finding a sense of belonging, right? And if that is what you are saying, I definitely know that all of us at one time or another have felt that way, regardless of what color our skin is, or who we represent. So it probably feels like you are a smaller minority in this place, or in this country, because of that. But I would say that the things that the panel have suggested today are useful for everyone. Whether you're white, black, brown, pink, or green, they're useful for everyone, because ultimately the reason why we don't succeed is because of the same types of things, whether it be discrimination, whether it be our own self-doubt, whether it be resources, whatever it is. And I think that advocating for ourselves, regardless of your nationality or ethnicity, is something that takes courage. And let's end our conversation tonight with talking about courage. The ability to have courage and resilience and bravery in 2025 is very challenging. And today we've learned that all of us need a little bit more of moral courage. All of us. And so, however you figure that out on tonight, whether it comes through self-care, whether it comes through community, whether it comes through educating yourself, whatever that is on tonight, grab hold that one thing. Whatever that one thing is you heard tonight, hold on to it and make it work for you. As a physical therapist, we learn not to give people 20 exercises. Give them 2 good exercises that they can be successful on. So whatever that one thing was, Jacinta, you heard tonight that resonated with you, hold on to that. Hold on to that, because I'm going to end here. It ends up, you all, not being about us. The people, the doctors, the nurses at Homer G. Phillips Hospital, they realized it wasn't about them. It was about the legacy that they created. So they made paths for us so that we can continue to make paths for others. And so on tonight, I'm going to challenge each and every one of you as we leave tonight, as you continue to ponder and think about all the rich things that people said on tonight. What's your legacy going to be? Because after you get over this hurdle, after you get over this, Jacinta, this lack of belonging or whatever you're feeling, after you get over it, it's for somebody else. It's for you to look back and say, yep, I remember how you feel. Not to minimize them, not to demoralize them, but to push them forward too. Because it's not about us. Those people at Homer G. Phillips Hospital, God rest their soul, Dr. Helen Nash, I know when somebody was a patient of Dr. Helen Nash, they're gone on to glory, right? But we're still here. And they're going to be doctors and physicians and OT assistants and dental hygienists and PTAs behind us. So we see in this little bitty block here, but there are several people that are waiting to march in your path. I want to thank each and every one of you tonight. I so appreciate each and every one of you. Thank you so much for spending time with us. I know we went over, so I'll give you extra credit. My students, I'll give you extra credit if you do your extra credit. Thank you so much for my panel. I appreciate you. I appreciate you. I appreciate you. All the students, all the other professors that are here, all my friends, my family. I love you so much. Thank you for spending time with us on tonight. We will officially end. I'll hang around if people have other questions, but you are dismissed.